Welcome to Going Antiviral, the podcast for the IAS-USA, a professional continuing medical education organization focused on HIV and other viral diseases. I'm Dr. Michael Saag, professor of medicine and infectious diseases at the University of Alabama at Birmingham and volunteer member of the IAS-USA Board of Directors. Today, December 1st, 2025, World AIDS Day, we are speaking with Dr. Rochelle Walensky, a professor of medicine at Harvard Medical School. Dr. Walensky previously served as the 19th director of the Centers for Disease Control and Prevention and as chief of the Division of Infectious Diseases at Massachusetts General Hospital. Dr. Walensky is an infectious disease clinician who has published over 300 research articles that have motivated changes to U.S. HIV testing and immigration policy and promoted expanded funding for HIV-related research, treatment, and the President's Emergency Plan for AIDS Relief, or PEPFAR. Dr. Walensky served on the front lines of the COVID pandemic in Massachusetts until the beginning of her tenure at the CDC, which started on January 20th, 2021. Today, Dr. Walensky joins us to share her experiences as director of CDC during the COVID pandemic and reflect on the current status of public health in the United States. Rochelle, welcome to the podcast.
So good to be with you, Mike. Thanks for having me.
It's great to be with you. I still look back fondly on my visit to Mass General back in the late 20-teens, and we had a great discussion, and it was wonderful to see you. But from that point,
and mine back at UAB.
Yes. So
we visited each other.
Yeah, we go a long way, and that's great. So let's go back to 2020. The CROI meeting was coming to Boston the first weekend of March and 2020, and that's about when COVID was exploding in Boston Harbor. Not, pun intended, but reflect on what that was like for you. You're chief of ID at Mass General. That week before CROI started, what was going on?
So first, I just want to say what an honor it is to be here as part of your World AIDS Day commemoration. And I'd never let World AIDS Day pass without remembering why I became an HIV doc and the many people whose lives have been lost and who taught me so very much in my journey, right? So I just want to say that. Thank you. Yeah, and what an honor to do this on that day. To get to your question, I was working on, I had been working on my oral presentation for that day, right? For the World AIDS, for the CROI meeting. So it was March 6th. We did not, of 2020, we knew of cases certainly in the United States on the West Coast. We obviously had seen the footage from what was going on in China. And I can tell you the room that I was sitting in when my beeper went off on March 6th, that said we had our first two cases of COVID SARS-CoV-2 in Massachusetts. Ultimately, we would learn that they were related to the Biogen outbreak. But I vividly remember knowing that my colleagues and friends were landing literally from around the world in Boston and thinking, this could really be a problem. If we have cases that were first diagnosed and first knowing about, now, there are probably more cases, and we are about to have a literal world meeting, a global meeting of people coming into this city. I remember calling Donna and say, I can tell you the seat I was sitting in when I called her to say, I think you need to know this. And we should sort of come together and think about what to do next. Certainly many more people than the two of us need to have a discussion in a seat at that table. But I remember that phone call thinking, there are probably only two ways to be wrong here: is we have the meeting and we're wrong, or we don't have the meeting and we're wrong. And one of them is a lot more risk than the other. So I was really grateful for Donna to take my call that day. It was not an easy call to make, and I'm certain not one she wanted to receive. And to a huge credit to IAS-USA and CROI and all the players at the time, that meeting quickly pivoted to a remote meeting in an extraordinary fashion. I will also say that one other thing, which is really interesting in retrospect, and that is Massachusetts Department of Public Health publishes their influenza-like illness data. And if you go back to February of 2020 and you look, influenza-like illness was going up and flu was going down. So at the end of February. Yeah. So our first two cases were detected in March. It was probably the case that a couple weeks earlier, some of those influenza-like illness cases were SARS-CoV-2.
Yeah, no doubt. And so I had just flown in on that Friday, which I think was about the 6th, and I walk into this maelstrom of discussion about, do we shut the meeting down? And the meeting was supposed to start on that Sunday, and it was shut down. And in 48 hours, the word got out to people who were planning to fly in, don't come, and it got converted to a virtual meeting that was enormously successful. It's almost like it was planned that way from the beginning. So tip of the hat to the IAS-USA staff and the CROI organizers to make that happen.
And I just want to say, and what's possible when people mobilize for a common mission to come together in a real crisis? Like if you had said, convert CROI to virtual in 48 hours, so many people would have said, impossible, not doable, right? And like that people came together for that common mission and that they were not going to lose the meeting.
Right. So I'm glad you mentioned that, because the next thing I wanted to go to was the following 2 to 3 months, right after the first part of February. Cases, as you just said, started to spike. Hospital emergency rooms got flooded. Hospital ICUs got overwhelmed. And we had to do something. It was a crisis. It was scary because as providers, we're thinking, okay, we got all these COVID cases. Maybe we can handle that. But what about the other people coming in for heart attacks or car accidents or God knows what? We don't have enough room at the end. So how did you all manage that locally in Boston?
I mean, it was an extraordinary time. And when people start reminding or thinking about the pandemic, I think that they're not remembering those times. And part of it was not just how scared people were. And some people were scared, but they had the privilege of being able to sort of hunker down at home, right? If you were sitting in the front lines of healthcare, you saw your colleagues as patients in the ICU. Because we did not know, as early as there were some people who were affected very, very early. And we, the ICUs got more and more full. The hospitals got more and more full. Remember, early on, we were not clearing people without 2 negative PCRs, but those PCRs lasted forever. So we were losing our staff for a really long period of time. It was very hard to rule out, especially people who only had lower respiratory tract disease. And so getting PCRs and having teams of people to try and look at infection control protocols and what we should do. I remember discussions about, first of all, who would ever have thought that we would have crisis standards of care discussions in the United States, putting 2 people on a ventilator at the same time, having primary care providers reaching out to their patients to say, should you come in? Do you want to be ventilated? They were asking them to do that. We were having discussions. I remember when we received a handful of remdesivir, the earliest doses of remdesivir, and we had to make a decision as to who was going to get it. I remember issues related to clinical trials. There were so many clinical trials early on that were ongoing, but how do you even triage what clinical trial is presented to a patient? And then how do they make a decision about informed consent when they're by themselves and on a ventilator in the ICU, right? Discussions about how our capacity was so very limited that there were discussions about a glioblastoma being a deferred surgery, not a mandatory surgery right now, because we needed the bed so very badly. Conference rooms being turned into ICUs. And, obviously they didn't have monitors. So students sitting outside acting as human monitors. I mean, and then I vividly remember sort of like, are my parents going to survive this? Mm-hmm. right? Like, this is what pandemics do, is when after all of this really, really hard, difficult, emotionally hard stuff, I had my own concerns. My kids were home, my parents, were elderly. So, like, how does that all go? So that was the swirl. I mean, I'm sure there was so much more, but that's and then trying to get the word out and trying to get the word out to our colleagues to say, you should start preparing. These are some of the things that you should start preparing for, because this is coming.
Yeah. And, I was actually swept up in the first wave. Ironically, I was driving with my son back from New York to Birmingham after CROI, and he was working at NYU, and their hospital was filled with COVID. I mean, they had, I don't know, 680 beds and 670 were COVID.
Exactly what we were at.
So he got out to go back with me, and he, unbeknownst to me, had picked up COVID, and we're in a car in cold weather sharing the same air. So I picked it up, but I didn't end up having to go to the hospital. But it was definitely scary. I remember
It's get right. I mean, you don't really know the natural history. We are just learning the natural history of this. I remember this, Mike.
Right.
I remember you're being rather unwell rather early.
Yeah. So you do a great job leading the division there through this pioneering effort of trying to figure out what to do for COVID. And then about 8-9 months later, you get a phone call from somebody, I don't know who said, "Hey, we'd like you to consider being CDC director." What was that like?
I mean, you know, what an incredible position. First of all, like, before, if you're an infectious disease doc, like, there are things you aspire to. You aspire to a podium presentation at CROI, right? You aspire to, ascending the academic ranks and becoming a professor. Like, I never even aspired to be the CDC director. So this was like not something was even on my sort of anticipated bucket list. I'll tell you what happened, and that is, right after the election was called for President Biden, President-elect Biden, I had received a phone call from somebody I had known previously working in the government, actually one of my former K mentees, who said the transition team is collecting CVs for people to work in the government. And I thought, okay, that's nice. But I had an interesting, I was on service at the time, actually. And I just remember having an interesting dinner conversation with my husband. Interesting that they reached out to me. And that was it. I didn't put my CV forward. About a week later, I was off service, and I was in my chairman's office having a conversation with my chairman. And I returned to a voicemail from Ron Klain, who was the president-elect's soon-to-be chief of staff, and was leading the transition team. And I remember calling my husband and saying, Ron Klain called me, and I have to call him back. And my husband said, don't say no. I don't know what he's going to ask you, but don't say no. Wow. So it wasn't this, and I actually assumed it would be something in Washington. I had no idea what he was calling for. And he said, would you consider a job at the CDC, the job of director at the CDC? And to my husband's credit, I said, I'd love to think about that. Because, I mean, like, as the time unfolded, like, this was an impossible job for a CDC director. It was an impossible job at an impossible time. CDC had frequently been thrown under the bus in the prior administration, and it was going to be impossible. I knew it was going to be impossible, and so I had these two things that held true all the time, which was, how could I possibly do this impossible job? And somebody's calling you to help. And, like, how can you say no to that? This is like the ultimate service you could do for your country and for people. I always equated, in fact, in my nomination speech, I equated it to running to a code. When your code beeper goes off as a resident, you don't think, I wonder if I can do this. You run, right? Mm-hmm. And we are trained to run. So though I knew it was going to be an impossible job and one very hard to succeed at, I also knew that I had a responsibility and a duty to run to the code.
Yeah. And, I didn't serve in the military. I was coming in post-Vietnam, but I always wondered what kind of service I could do for the country. And if I got a call like that, I would think about it in those terms. I didn't serve in the military. I can serve the country in this way. So it sounds like you are of like mind in that regard.
Yes, and I have a family who served in the military,
Yeah,
so
there you go.
I'm the granddaughter of a general. So
Yeah, awesome.
that
So,
rang true.
so now you're general of CDC. and you walk in the door on day one. You described it as being impossible in a way. What was it like in the first month while you were there?
Well, first I will say that several weeks before I had arrived, our head of security had told CDC employees to remove their parking stickers from their cars for vandalism.
Wow.
Several weeks before I arrived, my predecessor had received a note from a group called the 7 Acts of Change saying that the CDC was a racist place to work. Numerous things have been posted on the CDC website that were not approved by CDC subject matter experts. And we were in the middle of a pandemic.
Yeah, this is when
40,000 people are dying a day.
So Delta had hit. The holidays happened. Why?
Alpha. It was Alpha.
It was Alpha then. Okay, so it's going through families like crazy because of the holidays, and now the hospitals are getting filled up again. We do have remdesivir. We have a vaccine.
We've just gotten a vaccine.
Right, and you have to make decisions on who gets that first, the healthcare first responders, et cetera. So you take over. You're into your first, let's now say 6 months. What's your best recollection of the intensity and I guess chaos of a way of things coming at you like a kaleidoscope?
I mean, from a personal standpoint, I remember that the things that I needed to do in a single day would be, I would go from activity to activity to activity, and any one of them would make for a stressful week. Any single one of them would make for a stressful week. Yeah. I remember once my chief of staff sent me home, and I had all these members of Congress that I needed to reach out to and members of the Senate. And she said, you're going to do one of these on your commute home because there are not enough hours in the day. And I mean, just my commute home, I was in a rental car going to an apartment that I had just rented in a place I didn't know, and, directions I didn't know. And I remember like pulling into the shopping center parking lot, like I have to concentrate on this call with the senator. Like I can't do this in a rental car in a strange city. But that's kind of how it was. Everything. I mean, we did 3 times a week press conferences. So we were taking calls from the press 3 times a week, and then media after those calls. And then like trying to do all the work, right? Of like trying to decide where vaccines are going to go, how we're going to prioritize and strategize, how we're going to avert some of these deaths, how we're going to do outbreak investigations, all of the things that were sort of coming at us full throttle.
So the staff, you mentioned your CDC chief of staff, but my recollection of the folks who were there, I could name them, but there are hundreds of high quality, thousands of high quality, well-trained, dedicated people who they could have jobs elsewhere, probably making more money, yet they are committed, much like our military, to serving the public health of the United States. And because of the tumult, because of the turmoil, they are like you in this hot box of trying to figure out what to do. But meanwhile, social media, fringe voices are coming at you in a way that is threatening. Not just you, but a lot of people at CDC. You talked about getting rid of the stickers on the cars. That only adds to the pressure and the difficulty of the task, the impossible tasks at hand.
Yeah, I mean, one of the things I say about so while I was there, and obviously that's changed since then, we had about 12,000 employees and about 12,000 contractors. So a team of about 25,000 people trying to do the work that I like to say, you will never know their names or faces, but they are working 24/7, so you don't have to worry about health, right? And I will say among the things that's incredible about CDC is, unlike academia where you get a podium presentation or a big promotion or whatnot, I mean, you do get promotions and presentations at the agency, but it's just different. And it's not for academic sake. It's to save and help people. And the success of a public health agency is when something doesn't happen. And you know what? That doesn't make headlines.
Yeah.
So it was really, I had this incredible gift of working with some extraordinary people. It was nonstop. Among the things I really did is tried to get to know people. Now, remember, this is COVID, and the federal government was largely closed for in-person business. There was a lot of in-person business still happening at CDC by necessity. Our emergency operations center was open, our labs were open, but things that could be done remotely were being done remotely because the federal government was closed. Or was closed for in-person operations. So, I did a lot to try and meet people. I did a lot of one-on-ones. I did a lot of one-on-ones with my global staff because we work in 60 different countries. I did a lot of one-on-ones. I remember there was a civil unrest event in Haiti very early in my tenure. And my security team said to me, "We think everybody's okay." And I said, "I have to call the head of my Haiti office and say, is everybody okay?" They had definitively found that everybody was okay. But, that's not how you want to meet somebody. What do they say? You don't pass your business card out in an emergency. And so once that happened, I was like, I really have to meet my other in-country teams because I really need to know in case something happens that this is not the first time they're hearing from me. So I did a lot of one-on-one outreach with both state and local health departments and with my team across the country, with my division directors and my center directors. One other thing I did, which I I don't know which direction this goes as to where it benefited, but I asked my team, I got briefed by a lot of high-level folks in the agency. And one of the things that was very clear is there were a lot of people doing great work that I was never going to hear from, right? And so I asked my team to give me the name of 5 different people every week who had just done something above and beyond the call of duty that I might never know about. And I cold called them. And I just thanked them for what they were doing. So we had an employee who had rappelled out of helicopters to drop test kits on cruise ships.
Wow.
Right. And just to call them and say, I heard you did that for America. Thank you for that. Right. Yeah. So just like incredible things that people did that I just wanted them to know, I wasn't going to be able to talk to everybody, but I wanted to thank them for that.
Yeah, I'm sure that has incredible meaning for them. I mean, that's phenomenal. That's a great management strategy, if nothing else.
I enjoyed it too. It was really fun for me. Yeah. Every once in a while, they thought I was calling to fire them.
Okay. So we mentioned Delta. I got ahead of myself. So the vaccine seems to be working. Cases are coming down. I think we forget that it did seem to protect against symptomatic infection, at least people develop, until the summer, July in particular, mid-July, when there's this outbreak on Cape Cod, right? I remember this vividly. And I thought that we all thought the vaccine's failing. It only lasts 4 months. But it turned out to be an entirely new variant at that point. Describe, we're running out of time, but I want to hear about this.
That was like a real gut punch. So you remember we took it in about May or so, there was a New England Journal of Medicine paper that demonstrated with the Alpha variant and 2 doses of vaccine, that even if you were one of the few people who was getting infected, who converted and had SARS-CoV-2, that you couldn't transmit it to others. And that was when we said, okay, in May, you can take off your masks, right? Because even if you get infected, you can't transmit. You can take off your mask if you're duly vaccinated, had 2 doses. I wish I had said for now. I really wish I had said for now in that moment. 2 things happened in late July. One is many of the early people who got 2 doses were 4 or 5 months out. And the second is we got Delta. And you may recall for every infection, we didn't know which one you got, but Alpha actually overlapped with Delta. Mm-hmm. And for a while, and even if you go back and look at the footage in the ACIP meeting, we didn't know whether this was vaccine waning or whether this was Delta until we saw that Cape Cod outbreak. Yeah. That was a Friday night. I will never forget that Friday night. Everything happens on a Friday night. We first saw that signal. It was sequenced as the Delta variant. We had we were on the phone the next morning with the UK. They also were seeing transmission in these vaccine breakthroughs. And then we had another call with a site in Texas that had already seen this. So then an important question became, how quickly can we get the data out to demonstrate that what's happening here? And do we put masks back on? And how quickly do we put masks back on, before or after we get the data out? If we put masks back on before the data go out, people will say, why'd you do this? You didn't show us the data. If we wait until after the data went out, then they'd say, why'd you wait so long? You've known this for a week. Yeah. I like to say, as a leader in general, if any decision comes to you, it's usually because it was not one that somebody else could solve under you. And therefore, by definition, there are only bad options. This was one of them. So we opted to put the masks back on immediately, and the data came out within a week.
Yeah. And it was so hard back then. Schools were restarting. Do you let kids go back? And I think in retrospect, a lot of the naysayers, a lot of the super critics, if not hate critics, let's call them, take the CDC to task on everything. But I think what people forget is that, to me, a public health official is like a physician, except instead of talking to a patient, a single person, the public health official is talking to a population. That's their patient. Exactly. And just like with a doctor, a physician, things change. The facts change. The biology changes in that individual, and you've got to make alternative plans. Somehow we have to communicate that message better, because I think somehow public health officials are viewed as, I'm not sure what they think is motivating them, but just listening to your story for the last 25 minutes, it's clear you're there because you want to do the best job you can. I don't hear any alternative motivation here other than just getting the job done.
Right. Well, and if you think about the science that evolved from January 20th, 2021 to June 1st, 2023, if I didn't change policies based on new science that evolved, that would have been completely irresponsible.
Yeah.
Right.
Yeah. And if you were taking care of a patient and you ignored a series of lab tests that came back, that'd be malpractice, as it would be malpractice in public health, except for the population.
That's exactly right. That's exactly.
So we're sadly through our time, but I want to. I mean, it's been great. I want to get your view for the future, based on the current state of things in public health in general, at CDC, et cetera. Where are we, and what should we as individuals, especially in the scientific community, do to sort of help the situation get better?
The first thing I will say that I learned while I was at CDC was, we from the outside of government don't really understand the constraints of the people who are working in the government. And oftentimes when I had colleagues who would be on the air and sort of speaking to some of the policies that we had put forward when I was in the government, they were talking about things that are very reasonable from health standpoint, but not from the sort of 360 of where people are coming from. I had to consider how whatever decision I made would hold up in the Supreme Court, right? And truly, and whether CDC in the future would lose an authority of something that they need to be able to do if it didn't hold up in the Supreme Court. So the first thing I would say is, we don't necessarily understand the pressures of what is going on within the agency to be able to fully comment on how it's going. I will also say that I had the great gift of leading 12,000 employees at the CDC, and many of them are still there and remain extraordinary and are still doing their best to find foodborne outbreaks and to report on genetic relations in the measles outbreaks that are happening right now, and all the things that we really rely on public health to do. And there's still people there doing it. So let's support them. Mm-hmm. The logo has at times been hijacked. There's no question in my mind that there are things that are being posted on the CDC website that CDC subject matter experts have not approved. That happened before I was at CDC, and that is happening again. And it's very hard to discern now which ones are which. And that's going to be a really difficult problem for the rebranding of the agency when this tumultuous time ends. The next president's budget, to my understanding, calls for about a 40% cut to CDC. About 70 to 80% of that budget is CDC pass-through that goes straight to the state and local health departments. So if you think that this is only going to affect CDC, it is going to affect all of us around the country and how we manage outbreaks in health and prevention across the country. So I think, well, among the things that I learned in the agency is what needed to be done better and how hard it is to steer a ship in a different direction. It's a very large ship. And there were a lot of things that I felt needed improvement. There is no question about it. The way that it is happening now is not how I would have gone about it. By any stretch, we have lost massive amounts of talent, historical knowledge, subject matter expertise, and that is going to take years to recover from, I think, in our rebuild. It also will one day give us an opportunity to rebuild for a CDC of the future. And I would embrace that challenge and tell our young people that there's so much great stuff that can be done.
Yeah. And I do have a lot of hope for the future, based in large part because like you see young people every day coming into the field, eager, optimistic,
doing extraordinary stuff.
And they want to do the right thing. And that gives me some hope. And I think as a messaging thing, you brought up a great point. The average person on the street has no clue about how much their local health departments and their state health authorities get their funding from CDC. I know in Alabama, we don't have a very rich state, and almost, I think it's more than 80%, maybe 90% of our activity, just following local outbreaks, knowing whether sewage is being inappropriately put into streams and into rivers. Restaurants. I mean, it goes on. And we take it all for granted. So if people walk away from this current episode, hopefully they'll have respect and regard for what these dedicated folks do every day to help us, not only at a national level, but especially at a local level. And cutting budgets is not a way to improve our health, period. That's great. Rochelle, thank you so much. It's been a dynamic conversation. I've learned a lot, and I've developed even more regard from you just listening to your approach to things when you led CDC at a tough time. And I especially love those phone calls you made to those folks who did the extra mile. I think that is just fabulous. So thanks for being with us, and hopefully we can do it again at some point.
I would look forward to that. Thank you so much. Good to see you.
Thank you for listening to this episode of Going Antiviral. Catch up on earlier episodes wherever you listen to podcasts, and check out the video versions of this episode and others on the IAS-USA YouTube channel. You can find these links in the show notes, or simply go to YouTube and search for IAS-USA, and there they are. Be sure to subscribe, rate, and review Going Antiviral on Apple Podcasts. This podcast is for informational and educational purposes only and is not intended to serve as medical advice. Opinions expressed on this podcast do not necessarily reflect the opinions of the IAS-USA and its affiliates. And the viewpoints of the individuals on this podcast do not necessarily represent the viewpoints of their institutions. If you have a question you'd like answered on the show, you can send it to podcast@iasusa.org to be answered in a future episode. Thanks for listening.